Welcome to our video abstract for a paper entitled 6 months results of intravitreal ranibizumab for macular edema after branch retinal vein occlusion in a single-center prospective study, visual outcomes and microaneurysm formation. Anti-VEGF therapy currently is the first-line therapy for macular edema with BRVO. However, which patients should be treated, when the therapy should be started, or the treatment regimen has not been well established. In the current study, relatively early administration of intravitreal injection of ranibizumab followed by 1+ BLN regimen with a strict retreatment criteria for macular edema in BRVO was prospectively examined. Method is as follows. The criteria included a minimal age of 18 years, 20 letters or more BCVA, ETDRS score 77 letters or less, and central retinal thickness of 250 microns or more. Retreatment criteria included loss of 5 or more ETDRS letters compared with the previous visit, central retinal thickness of 250 microns or more, and evidence of residual or recurrent macular edema included peripheral lesion. Features of the current prospectively study is as follows. First, patients with relatively good baseline BCVA were included. Second, the duration between disease onset and initial therapy was relatively short. Third, the treatment regimen was 1+ BLN. The retreatment criteria is strict. The primary outcome measure was the mean BCVA change from baseline at month 6. The secondary outcome measures were mean changes in central retinal thickness, residual macular edema, and microaneurysm formation. Results is as follows. 20 patients were enrolled. Baseline mean ETDRS letters and central retinal thickness was 63.1 and 500 micrometer. Mean time of initial therapy from symptom was 1.8 months. The mean ETDRS gain and central retinal thickness reduction was 15.2 letters and 200 micrometer. The percentage of patients with Snellen BCVA of over 0.5 and 1 was 95 and 70%. Residual macular edema and microaneurysm were observed in 85 and 35% of all patients. Microaneurysm formation was associated with delayed initial therapy. Conclusion of our study is as follows. Early start of IVR provided better visual prognosis at month 6 and suppressed microaneurysm formation.